Lucknow, UP, India.
Yes.
Welcome you in today's webinar, sir. And I also welcome our dignitaries like Professor Dr. A.K. Singh, Honorable Vice Chancellor, Sri Ram Swarup Memorial University, Lucknow, Professor Dr. Ajay Prakash, Professor Pro Vice Chancellor, SRMU, Lucknow, and Professor Dr. Manju Pandey, Director, Institute of Pharmacy, Lucknow, and Professor Minhua Chen, our chief guest and today's speaker. Welcome, sir. And the today's topic is webinar is application of VR technology in healthcare and medical education. And some description about virtual reality or VR is a computer generated environment with scenes and objects that appear to be real. But before starting the session, I would like to introduce our chief guest, and the speaker of this session is Dr. Minhua Shen. Sir, Dr. Minhua Shen, sir, Director of Career Service Center in CYCU and an adjunct to Assistant Fellow of Engineering and Nanomedicine, National Health Research Institute. He is currently working as an assistant professor in Department of Engineering at Chongyong Christian University. And sir is some sir has so awards and degrees like he obtained his bachelor degree and master degree in material science and engineering from TAPI technology and completed his PhD in 2015 from National Taiwan University, Taipei, Taiwan. He has undergone international research cooperation with the Tokyo Technology and the National Institute of Material Science in Japan. And he was also awarded for being a Japan Society for the Promotion of Science postdoctoral fellow during 16-17 at NIMS. And sir also have some academic research doing some academic research like Dr. Chen is recently researching several fields such as nanomedicine in controlled release, radiobiology and bioceramics for dental application. He is the editor of both journal Biomedical Technology Research and Advanced Biomedical Science, and has currently acquired the research project and collaborated with the National Health Research Institute. Thank you. Welcome, sir, and please start your session.
Okay. Thank you, Professor. Thank you very much for your kind introduction. And I would
Thank
like
you
to,
so much, sir.
I also thank you very much for the director of the institute to invite me for this talk. Thank you very much, director. Yes, and I would like to
Welcome, sir.
share today's, maybe, can you see? Okay, maybe, let me check how to. Okay, so I would like to start today's my talk. Today my talk is about the application of VR technology in healthcare and medical educations. I'm an assistant professor from Stanford University. So at first, I would like to briefly introduce, this is my lab. I would like to thank you that we have some Indian student in my lab, Kang and Shupong is undergraduate student in last year, and Kang is in my lab. He is now a PhD student. So I'm happy to have an Indian student in my lab because they are very professional and very hard work, I think, compared to the Taiwanese students. So thank you very much for that, have this kind of cooperation between Taiwan and India. And actually, my background is material science. I'm working for some materials and in biological applications. So my lab is a small and a control release lab. We are looking for some good new materials for biological application. For example, we looking for the skin cancer treatment with some radio sanitizer. This kind of material can be synthesized, stimulated by the X-ray or radiation treatment, so we can enhance the radiotherapy. And I also interested in topic of microneedles. So we use this microneedle for the treatment of skin cancers. So and Kang is just Mr. Kang is just in this work. So I'm happy that international Indian student to work in this field. It is my major field. Okay, so actually my background is material science, and we look for the application of the medical applications. But why today my topic is about VR? Yeah, because maybe 2 years ago, I'm atomic. I teach the atomic in my department, and at that time, actually we don't have we are not a medical school, so in our university we don't have any cadavers or whole body for the student to check to know the anatomic. So 2 years ago I start up establish these centers. This center is a medical VR self-learning centers. At that time we import yes, at that time we use the VR device, so that the student can use this VR device to learn about anatomy. So today I would like to share what how to use this kind of VR device, or how to use the VR for our medical applications. And this is the environment of my of this center, so the student can learn about use the VR, and to learn about how to learn about our anatomy. Later I will speak this part in detail. Okay, so what is the VR? There's a visual reality, and it's a simulated experience that can be similar to the completely different from the real world. So actually the student can use this VR for a kind of learning. It's very close to the real world. So in VR application, there are several applications can be used in healthcare, such as we can share the decision making using the VR system. To the clinical doctor can share the information with the patient's family, and also patient education, teach them how to what the anatomy, what the problem of the disease, because usually most of patients actually when they before doing the surgery, they don't know why they have to do that, what the difficult during the surgery. So we can use a VR, let them know, realize that wow, during the surgery that's more complex. Okay, and also we can use a VR for kind of training, medical training, surgery training, clinical skill training, and the pain management. Okay, later I will focus on pain management and using a VR for creation, music therapy, physic, psycho. I'm sorry. Yeah, I'm sorry because I think today my computer seems not so stabilized. Sorry about that. Okay. Yeah.
Yes, sir.
Yeah. Uh, uh,
Sir, your screen is clearly visible to all. I think there is no issue. There
Okay.
is no issue. Okay.
So psychotherapy, uh, and some training, art therapy, rehabilitations. So this is all the clinical use. We can until now is a healthcare that we can use this kind of VR applications. So what is the VR? Actually, they have some hard work. For example, we have a base station. This is a base station. We can see in here. Okay, let me use this. Okay, base station. And also we have a headset. So usually we have to wear a headset and with a controller. And also we need the computers. So in here, we use a headset using a controller and the controller computer system. So this is the basic assessment of the hardware for the VR. And what the purpose of base station? Actually, base station is just a camera. It can monitors the location of where you are. So we have a 3D 360-degree rotations and the movement. You can mimic. You can catch your location during these scenarios. Okay, until now, there are several VR being used, such as Valve, Oculus, or HTC. This is a company to create this kind of device for the VR use. But not only this, also a lot of company, Google maybe also have a VR a device. So actually, there are two type of VR. One type is base station is outside, and one type of VR is a base station is inside. Inside the if the base station is inside the VR, usually this VR you can wear it without using any computers. But usually that this kind of system is until now the technique is still quite slower. It's not sensitive for your locations. So until now, if this VR is used for the game, we need to very precisely know the location. And this kind of VR, usually we have a base station just outside of our headset. Okay, so there are two type of VR until now we already been used. And in this right side, because the base station inside, so student can wear this and they can learn the anatomy by themselves in with just very freely to use. Okay. So today I would like to introduce some advanced healthcare through the VR applications. I separate in three parts. The first part is a medical educations. And also second part is the clinical applications and the research. In the medical education, such as see and the practice, okay, we can see and practice. And clinical application like cure and communicate with the patient's family. And also research, we use this kind of device to develop some new drug. Okay, so I will be more detailed to introduce and also show you some video. I hope today the computer can be stabilized. Sometimes it's not stable. I apologize for that. Okay, so the first is medical education training. So for the educations, it's very important. Before we have some traditional learning, usually the traditional learning is not able to scalable and the lack objective data leaving the people to underprepared. So there are several kind of traditional learning. This is the ability to scale up. The higher scale up is a manual or e-learning and with a video. But the scale up usually for the traditional learning, the scale up and the effective of learning is just the opposite. So if we can have a more effective learning, usually the scale up could be lower, such as videos and webinars. And now we are a kind of videos and webinars, okay, and the remote event and lecture workshop. And sometimes some have a high cost of subjective data, such as simulation and role play and one on-the-job training or one-to-one expert membership. But looks quite a difference for the VR learning. Usually, the effective and the scale up could be enhanced through the data science insights and the scalable cost for the VR learning. There is a report from the Los Angeles Children's Hospital. There's a clinical doctor say, one student get immersed in one of his VR modules, their heart rate raises about 10%. What it means? Actually, this means that if we can let the student heart rate raise about 10%, they can be more interested in the learning. So that's the reason the VR could be used to improve the students' interest and also improve their learning. So that's why we think maybe we can use a VR to teach the student how to know about anatomic and to improve their medical educations. So there is an example. It's a VR system. We can use a VR and to create. Sorry about that. Yeah, I'm sorry. I'm not sure why today. Maybe the data is too big in this time. So I'm sorry about that.
It's okay, sir. No need to say.
Yes.
It's okay, sir.
Okay. Oh, I hope it will not so bother you. I'm sorry. Today seems not so stabilized for my computer. Okay. So I think I will just make it small, this kind of size. Maybe it will be better. Okay.
Yes, sir. It's okay.
Okay. So usually we can look like this. We can develop some materials. We can use a VR to create a document for medical training like this. So this is a content of creation. Okay. So the clinical student or some medical doctor, they can use this VR and for the training. This is a kind of training. So they can catch, create a video, and also add some questions in during the process. Okay, so this is how to create the questions, how to have the answers, and we can use this VR like a 600-degree player, so we can more close to the environment to wear this VR. Okay, so this is a clinical health environment. And also we can have a multi-user for simulations, the environment, the scenarios. And also some question, yes. And the survey doing their answers. And also we have AI power like this kind of system, and we can ask a question. So, and we can use a controller, like maybe later it can show that it's a kind of examinations, and they need the injection. So the student can take this kind of injection and mimic the environment. Okay, so VR create the scenarios, make the students more close to know what is the real world or what is the real environment. Okay, so there are so many challenges. I'm sorry, I'm not sure whether this will be okay. So maybe I will not explore to large size. Okay. So in the previous, we have some learning system. We use the textbook. We use tablet, and you use the virtual anatomic tables to study about the anatomic. But usually the results seems not so interesting for the student. So that's why recently we have some revolutions. I hope it work. We have some revolutions. So the first step is a tablet computer and the desktop computer for the digital anatomy learning. And their third generations is virtual anatomy tables. And now we also have AR and the VR. The fourth and the fifth generation is uh, augmented reality and the virtual realities. And now we have online VR classroom and also online VR with AR classroom. Okay, so this is the evaluation for the digital anatomic learning. So we can use this kind of, actually it's not only VR, we can combine a lot of tools for the teaching, including course preparations, anatomic experiment class, and the preview and the review, and also the group discussions. So we can see in the VR it's not only a cadaverse. We can see their movement. This is the new type of new version of VR. Usually is flex. We can see the flexibility, flexion, extension, or shoulder joint. So the student will know more about what the movement for the muscle or for the bone. Okay. And not only our gross body, also we can learn about some microscopic anatomic models. There are several tissue parts, such as our skin, lung, and this is a ear, and also a teeth. So a student can not only study about the gross anatomic, also about the tissues inside the most micro scale part. We can let the student to immerse in this environment. So why it work, maybe we can see in here. Okay. Yeah, so in this kind of system, the student can immerse uh, in the real environment, so that they can increase their interest in. Also, there is a movie about this system. We already have this kind of VR anatomic system. Check. See. Yeah, so it's a very interesting system. So the student can like immerse in that cadaverse. So they can try to separate each organs, each tissues, and then know the movement of the body. And also some new versions of our VR system, we also can they also create some disease system. So the patient, because we are the Department of Biomedical Engineering, and the student can understand, oh, really, that the disease, if this disease happened, what the bone, what the structure, maybe like the structure can be changed, why? And there are some models for the disease patients. So this is a new versions about anatomy that the student can learn more about this kind of system and to have more imagination for the study about anatomic. And also we can use this kind of system to let the student to have a homework. This is my student, they prepare their homework, but they are speak in Mandarin. Maybe we can just try to, we can see. They prepare this is their okay, because it's in Mandarin, so I stop in here. So here I would like to show you my student is not only use VR for the learning, they also have a homework for preparing. They have to image, they have to copy their introduction. I asked them to introduce one of the system because in our body we have 11 systems. So the student know how to um, introduce one of the system, and also they should tell me what kind of system, what kind of disease will happen in this system. So in this video, is my student. They introduce one of the disease in thyroid. Okay, so they have a lot of version. This is the version for the Mandarin. So maybe Indian language also have in this in the system. Okay, so and recently, some university in Taiwan, we also have this kind of system. For example, this is the Taipei Medical University. They use this system that the student can operate, use this system before the real cadavers before the surgery of the real cadaver. They can practice it to more know about the anatomic system. Okay, so they use this system before before the experiment in the real whole body. And this is at the Stanford University. They also have this kind of system. And their system is image creates using the patient's MRI and the CT scan. So in their system, uh, until now, our system is a simulated system, but in the Stanford University, they can impose the patient's
Aryan, please mute yourself.
yes. Okay. So at the Stanford, we can also have this kind of system. This system is important with the patient's MRI and the CT. Okay. Maybe there are some background noise. I'm sorry. Okay. Yeah, it's okay.
Please mute yourself.
Yes, now it's okay. Thank you very much. So there is a survey about the classroom, e-learning, and the VR. What the difference? That this survey that found that they after the VR, the source is from 2020 PwC, that using the VR compared with the e-learning and the traditional classroom, it can be faster to train than in the classroom, and this is 3 times more emotionally connected to the connect than the classroom learners, and also 275% more confident to the price learner after the training, and 4 times more focused than their e-learning peers. Okay, this is a kind of survey. And actually, in the VR, we can use the VR not only to know about anatomy. Actually, VR, we can also create the educational materials. So this is a kind of system. Okay, let me check it. Okay. Uh, this is this we can use VR not only learning, we also can create some material like this. So not only the Department of Biomedical Engineering can use that, maybe some arts related of the student, they can use the VR to create to drawing, and this drawing is the 3D structure, 3D patterns of drawing. Okay, so it's quite interesting for using the VR. Okay, so I hope maybe in the future we can see, we can image that the student use the VR for the self-direct study. They can study in the library, they can study anywhere, and before before only when I was young, when I was young age, usually we just bring the textbook to the library. But when I getting old, when I was undergraduate student, I can see that a lot of students start to use a computer. They have their own laptop to study in the library. And in the near coming future, I think maybe we can see some students that use wearing the this kind of VR system for self-direct study. Okay, this is a part for the self for the C for the using the VR for the medical educations. Also, we can use this kind of VR for communications with the patients. Okay, this is in Taiwan, Taipei Wanfang hospitals. They before the surgery. This is the patient. We can see the patient is in here. Okay. Okay. Point. This is the patients. So the clinical doctor, they can before the surgery, they use the surgical plan by the VR and step into the patient specific 360 degree of the VR reconstruction for the anatomy and the pathologies. Okay, so using this kind of system, on the right side is a clinical doctor and this is a patient. They will immerse using these two kind of VR, merge in in the same environment, so the clinical doctor can communicate with the patients and let them to more understand what the risk, what the treatment, and what the safety for this surgery, so they can be uh, more safe to know, and they can more clearly understand the risk during the treatment. Sorry. And actually, for the VR can also be kind of education. Recently, because of COVID-19, and this is a video from a movie. This is the TV movie from from Taiwan. They just use this VR, the same system, and to teach the people in Taiwan what the problems about the COVID-19, what the problem about our lung. So we can just briefly to see this video.
我们是用 VR 最新。
Okay, I'm sorry that is in Mandarin. Okay, they speak in Mandarin, but you can see on the right top there's people using the VR system. They move it. And another clinical doctor just introduced to the peoples what happening, the infection through the COVID-19, so that the people in Taiwan will know more. Oh wow, what the reason, how to protect themselves, how to take care of themselves. So this is a system that training the people in Taiwan to get awareness about the disease of the COVID-19. So the people can not take care about themselves because they know the anatomy. Wow, what this is very complex or very dangerous, and wow, it's very close. The lung is close to the heart. So that's why what usually the patient have this kind of disease. Okay, so this is a kind of education system. And in the marketing, usually in the medical marketing, because my student from the Department of Biomedical Engineering, in the future, some part of the student will be like a staff for the seller. They will sell the medical device in the future after they graduate. So we can use this kind of VR. A student can create the environment, and also in the future, if they have a new product, they can share the information and immerse the clinical doctors, immerse the sailors or some department people at the same environment to tell them what's happening during this during the procedure, during the surgery process. Okay, so their product in the future for the sailors, for the marketing sailors, their talk maybe is quite different to the quite different compared to now, because they can use new tools for the communications, improve their skill. Okay, so literally we can also use this kind of VR for clinical skill training. We can just look at this part. This is a surgery practice through the VR, and in this environment, this is a cooperation between Taiwan's our general hospital and with the hospital from Japan. So in the Japan, they maybe have some special case in disease. So they can video, they can copy, they can image the process. So and they import into the VR. So it can be a kind of sharing information about the surgical practice, because some case maybe is that maybe happen in Japan, but some case maybe only happen in Taiwan. So we can using the VR and the sharing about the information during the operations. So this is a kind of teaching surgery in VR. Okay, so the patients, the clinical doctor can know about how the previous clinical professional clinical doctors, how they do these kind of procedures, and they will be more. They will reduce the misunderstanding for the procedures. They more clearly, and they can self direct study by themselves. Okay, and so this kind of visualized VR can provide an immersive and interactive training experience, and a more clear understand what happening for these conditions. In Taiwan, neurosurgery is very popular in Taiwan, so there are lots of companies that would like to have a cooperation with the neuro clinical doctor in Taiwan to develop this kind of VR system. Yeah, I look forward in the future have this kind of cooperation in Taiwan and some other countries. Okay, this is a surgical process that we. So this is also the medical training training system for the medical student. They can training use this system to 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 learn how to operate our knee implant surgery. Okay, so and then doing they using the holder, they also can feel the force from the bone. So this is quite mimic the real environment. Okay, and also there is a Children's Hospital Los Angeles. They create the environment. So before the big surgery, all the clinical doctor they can learn more about the environment. They can know the environment, what happened in that room, and how they can step by step for the surgery, and to enter a virtual world and practice saving the baby's life. So some babies, if they have big uh, accident, usually that is very hurry, so they need to practice. So VR can improve them to know to familiar with the environment, and to know how to process during the big serious accident for the babies. So in the VR, maybe this is also a environment medicine. So it's happened again.
Father,
I'm sorry. Sorry, just wait me a moment. It's the conditions. Okay. They also have the CT mode. It also can control the environment of the lamp. Okay. So this is company for a clinical scale VR training using this kind of system. Okay, so in the next part, I would like to talk about the cure, precision surgery, and the pain management. We can create the environment for some pain management, because sometimes they will focus on more attention for their pain. So if they have wear some this kind of VR, maybe they can reduce their attention for their pain, and can helpful for the patients for the treatment. Okay, and also the physical therapy. That's there are some in the University of Washington, Seattle, and and the Burns centuries. They're using this kind of physical VR physical therapy, so the patients can practice. They can be have a joy. They have a joy. They have a interest during the practice, so they can continue for improve their health. Okay, so this is kind of physical therapy. Where this and so until now, VR also can junction your location of your hand. So by this way, they can know more how to move in correct way. And also disease awareness. For example, the Parkinson or some disease, psychological disease. Usually, this kind of patients, they are poor to have an interaction with they are poor in the social scale. So they wear this kind of VR. So this VR can create a real environment. So they will have some tests when they face when they face the people, if their movement is incorrect or if their response is incorrect, the VR will awareness them. Let's take care for how to have a correct environment so they can encounter a word moment when coming into contact with other people. So this is also helpful to help the psychological disease problems patients. So they can create the environment more joyful and maybe okay, maybe we look for this video. So the VR can create some environment to reduce the pain from the patients and also reduce some uh, nerves from the patients. So this is another, I would like to share another video. Usually that's the patient is in a very heart disease, so they cannot move, they cannot go to the mountain, their heart seems very down. So we can use this VR to for a kind of cell. We can look at this video. Okay, So I would like to move to our last part. And in the last part is research, what the drug development. Sometimes because you are in the pharmaceutical field, I believe you know that some pharmaceutical drug is some pharmaceutics is very complex structure. They have a very complex structure. So we can using the VR can more clearly uh, to for 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 design a correct molecules. I'm sorry. Yeah. Okay. Okay. So so in the last, this is a video for design. Maybe I will use this video. Maybe Roger. Not just okay. So I think in the futures of VR, the powerful of VR is to create more emergence, more interaction, and the more imagination in the future of VR. And not only VR, but also the AR. I think recently they are quite popular in, in the AR. So I would like to go back to our first slides. I want to end from this slides. Uh, if you forget all of the content in today, but please remember in next day, in few days, in the next coming days, we can use the VR in the medical education, and including the C and the practice, and also in clinical applications, include the communicate and the cure, such as today we talk about the pain cures, psychological cures, and also physical therapy. And also we can use this like development tools. We can create the drug through the VR, so we can more precisely to develop new drug through this VR system. And in the practice, we can let the medical student to practice through the VR to mimic the environment. And in the education part, today we talk about the C. We create the materials and also to create some survey and in the VR system, and also the student can immerse themselves in the environment of anatomics, because our university, some universities don't have cadavers. We can use this kind for training. So I believe the students could be interested in this field. So this is my talk, and in the final, I would like to thank for HTC, because we have cooperations. We also have this kind of system in our department, and we cooperate with HTC. And in today's materials, most of material are provided from Mr. Ruiz. They are in this field of experts, and I am in material science, so I'm hesitant to share this information, but I'm happy to share some news that I know. Also, in the end, I would like to thank you very much for your invitation. Thank you, director, and I'm happy to have an Indian student in my lab. So I also welcome you to join us in the future if you are interested in some material science, or you are interested in using this VR system. I highly welcome you to come to my university. Thank you very much for attention. Thank you very much. And this is a QR code from my lab. If you are interested, please come to come to our lab's website, and you can know more about our history or our information. Thank you very much. Yes.
संचालका अनम्यूट कर लीजिए.
Yes.
Thank you, sir. I would like to take this opportunity on the behalf of Institute of Pharmacy, SRMU, to say thank you to our chief guest, Minhan Chen, professor in Chang Yun Christian University.
Yes.
And we are grateful to you for accepting our invitation and becoming the chief guest for today's webinar.
Yes.
And I must say, as we are moving towards the application of the new technology in the field of discovery of new chemical entity to track the different shapes it can take and reduce the error rate that comes with the drug discovery processes, and obviously diagnosis of the different disease. So it can increase the higher patient compliance by physical therapy, as you say, and for the cure management, etc., and to use to create the educational material and all.
Yes. Yes.
And I must say it was a great lecture, and so I hope today's webinar will be very grateful, will be very fruitful for our students to understand the importance of the VR. And thank you for a very full and knowledgeable lecture. And I extend my heartfelt gratitude and thanks to take out time from your busy schedule. And I also want to thank Mr. Yaku, who is a research scholar in the Chang Christian University, and also my PG student, and Ms. Sanchalika, who is the coordinator of this webinar. And thank you, students present here. And thank you, sir. I look forward to hearing from you soon. And again, thank you so much, sir. Thank you.
Thank you very much. This is my honor. Thank you. Yes. Thank you very much for your invitations. Thank you.
Thank you so much, sir. For this.
Thank you, sir.
Thank you. Okay.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you very much
Thank
for
you,
your.
sir.
Thank you, sir.
Thank you, sir.
Okay. So then we
Thank you, sir.
Thank you, sir.
see you.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you. No problems. Yeah.
Thank you, sir, for your
Thank you so much, sir, for this